Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Johns Hopkins psychologist Laura Murray returns to the podcast to talk COVID-19 mental health with Stephanie Desmond. As we come up on 2 years of the pandemic, they discuss the lasting impacts of the behavior changes we have made to protect ourselves. Let's listen.
Laura Murray, thanks so much for returning to the program.
It's great to be here again with you, Stephanie.
So you are our mental health go-to expert when it comes to COVID. And here we are just about 2 years into this pandemic. And first of all, I can't believe we're still talking about this pandemic. I can't believe this pandemic is still going strong.
Right.
But I want to talk about sort of this long-term effects that this could have on our mental health. I mean, there are people out there who are saying, well, I'm done with COVID, and they're behaving accordingly. That's not necessarily the best answer immunologically. There's a lot of people who don't really, they're sort of caught in this limbo. What are you hearing?
Gosh, Stephanie, same thing. Lots of people on the spectrum of saying, I'm done with it. There's going to be no more masks. I'm not staying indoors anymore, and really going about their life, feeling like that's the best thing for their mental health and their sanity. And that runs the gamut all the way right up to the other side of people saying COVID's still really significant and I'm still going to stay inside and I'm not going to go anywhere without a mask, et cetera. When we think about the long-term effects of mental health, first of all, I think it's important to say no one knows. The research hasn't been done. We're not so far out that we're able to officially look at it. So everything is really based on hypotheses or what we're hearing from people, where were you a year ago and where you are today. I would say a couple things that we're seeing. One, everyone's going to manage their mental health in a different way. And I think what's interesting to see is when we talk about people along that spectrum of I'm done with COVID to COVID's really still present in my life and I really want to be careful, many of those differences are because people are aware of what they personally need to do to take care of their mental health. And we're going to see those differences, right? And it really has to do with personality type. It probably has a lot to do with how they have experienced COVID over the last 2 years, whether they've had some significant health issues or run-ins or long COVID versus maybe they just had Omicron and didn't even have any symptoms. So I think we're going to continue seeing that spectrum. The second point I would make is from a psychological standpoint, and we've said this from the beginning, Stephanie, I feel like in every one of our podcasts, this is still an ongoing learning experience for all of us. And it's great to just understand that there are going to be those differences. There's going to be people on every level of that spectrum of where they stand with COVID now. And just to give yourself and everyone else a little bit of grace, really trying to understand that your position may change and maybe it should change as COVID keeps advancing and changing and we learn new things, and give others that same grace and understanding.
So I used to be really social and I used to go out to dinner and I would go out to the movies and the theater and all kinds of things. And for the last 2 years, I have not done any of that. And so I guess my question is, will I ever recover or will I remain a hermit forever?
I hope you don't remain a hermit forever. What a great question. And I think a lot of people are going through different stages of this, especially over the past 6 months, as different places open up a little bit more. Just from a pure behavioral perspective, right? As human beings, we get used to doing or not doing certain things. And so you can look at, for example, if we get used to a life where we don't exercise and then we try to shift to exercising, right? Or eating in one way and trying to switch that. For all those types of behavioral patterns, it takes time and it takes motivation to shift that. And if you think about it, whenever you try to shift your schedule or your sleep or your eating, there are many days where you think, am I ever going to get there? Am I ever going to really make that change? And I think this is very similar. Many of us have gone through parts of these 2 years where we have gotten very used to not socializing. And so socializing is sort of this thing we have to not necessarily totally relearn, but we have to re-get used to. And I think the constant variation in where COVID stands, when things are open and when they're shut, and when we have to be careful, and when there's an outbreak and when we're more okay, has made it difficult for people to really feel like, okay, I can now get on track to try to get back to maybe being more social if that's something that you want to do. So I'm optimistic that I think if people want to move in that direction and when and if they feel like it's safe, it should be viewed just as a normal change, just like we try to change any one of our other behaviors, and take it in small steps and do it as you feel careful. And I think we can, you can move in that direction or choose not to, but definitely room to be optimistic that you could start socializing again, should you choose to.
I think about it in terms of work as well. I used to go to the office 5 days a week, commute downtown, park in a parking garage, the whole rigmarole. And now for the last 2 years, I've been fortunate enough to be able to work at home. The idea of ever going back, it seems so far from reality to me. What do you see with sort of those kinds of habits?
This is a very big topic right now. And I think that's because we saw many people having to work from home and not even really having the option to go into the office for a while when COVID started. And then there were time periods where business leaders were deciding, should we open, should we not? Some maybe did, and then very quickly maybe shut down again. So I think, again, that fluctuation is challenging if we want to keep a habit or break a habit, right? Because the context is constantly changing. And so I think one of the most exciting things I've seen is people grow in self-awareness through this process. I'm sure that's probably pretty cheesy to a lot of our listeners, but as a psychologist, it's been fascinating to really watch people who, like you said, Stephanie, have always they entered the workforce and this is just what you did. And there was never any other option. They couldn't ever experience any other reality than getting dressed, going to the office, parking in the parking garage, as you said, there you go. And what this has taught people is there are some people who flourish if they don't do that. And then there are people who are dying to get back into the office. They flourish with that type of behavior. And so I think it's just a variation and an opportunity to learn more about, hey, what really works for me and how can I facilitate that as long as my employer allows me to?
I want to talk about kids and COVID and sort of the long-term effect that this might have on them. I mean, I've watched my own children who are in high school deal with sort of essentially much of their high school experience is going to be sort of based on around COVID, about they haven't gone to school for stretches of time. They're wearing masks when they go to school. At some points, sports were canceled. Is this going to impact these kids forever?
It's a great question. And something I think a lot of people are starting to think about. Scientifically, the truth is we just don't know yet, of course, but we can hypothesize some different things. Do we think that it's really going to have detrimental effects on the kids? I would say right now, our current thought is no for most children. It has been very frustrating for a lot of them. Many youth, especially in high school, are missing out on key opportunities. And for those that might be going on to school, for example, not being able to do in-person interviews, or for some even missing those first years in person. The thought around being optimistic that this is not going to affect them long-term comes from just the resiliency we see in youth. Youth tend to be very adaptable and much more resilient. And also, historically, look how many generations of youth have gone through awful things in their life, right? The Great Depression, world wars, lots of different things that different generations have gone through in their youth and have in general turned out okay. They've managed in different ways to get through it. And so, from a psychological standpoint, we're looking at it as, yes, this generation of youth has had to deal with a pandemic, but other generations have had to deal with different adversities also. I think one of the important things I'd like to just bring this conversation to, Stephanie, is what can we do to help ensure that kids aren't affected negatively in the long run? And where we hit on here is families. This is a time where families become critical of paying attention to your kids, keeping those lines of communication really open with kids, and talking about being resilient and how to be resilient and how to overcome so that it becomes more of a life lesson and a growth area for them, rather than talking about it in, oh my gosh, your life is going to be so different and negative because you've gone through this pandemic. I myself we've had some great conversations about what other kids go through in different countries, for example, that is really challenging. For example, kids in Haiti, right, that have gone through, awful things, or kids in Lebanon and Syria right now, and how their lives may or may not look. I think talking about the history of the United States too is not a bad idea, to give them some optimistic thoughts around, hey, other people have gone through rough things and they've been good. But then if your child is someone who's struggling more, that is a good time to reach out and say, my child may not be going through this as well. And maybe it's time to get help or sort of build some of those skills of resiliency.
And I guess it's hard for a parent to look on the bright side if their mental health is impacted by the pandemic.
100%. And I'm so happy you brought this up, because you and I both know as parents, I think parenting is one of the hardest things I've ever done in my life. And every day is a new challenge. And I think that's not for the weak of heart, to try to overcome this. And of course, parents are going through their own thing. And I think we talked earlier just about going back in the office, staying out of the office. There's so much going on in parents' lives that it is really important to pay attention to our own health and wellness in order to make sure that our kids aren't impacted as negatively as potentially they could be.
How much longer can we do this?
As long as it takes, Stephanie. As long as it takes to get through this and to get our kids through this.
Absolutely. Laura Murray, thanks so much for joining me.
Thank you.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.